Decker, our president and CEO of Spectrum Health. We'll also hear from Dr. Daryl Elmucci, president of Spectrum Health West Michigan, Dr. Hussein Marandi, president of the Helen DeVos Children's Hospital, and Dr. John True, president of Emergency Care Specialist and an emergency department physician here at Spectrum Health. And then we will open it up to questions from the media. So please place your questions in the chat. We will call on you to ask your questions live, and we will answer all the questions as time allows this afternoon. So to get us started this afternoon, I'd like to turn it over to Tina. Thank you, Tina.
Thank you very much, Carrie. Good afternoon. Today, we wanted to share an update with you on the status of COVID-19 in our communities, as well as the positivity rates, the case counts, and the hospitalizations. Currently, they remain high, but we are hopeful that we have reached a peak this past weekend. But what is concerning is that the virus is very clever and it continues to evolve. You know, the COVID-19 that is circulating right now is not the same virus that we prepared for last spring, nor that we experienced in last fall. It is this B117 strain that is most dominant in Michigan, and it is at least 50 to 75% more contagious than those previous strains. It has the propensity to spread faster and cause larger outbreaks, particularly among unvaccinated persons. And it also appears to have a higher propensity to be spread by infected elementary school children, in contrast to previous circulating strains. So we are seeing an impact with more COVID-19 in kids. This morning, I walked around our children's hospital to see our team and ask our physicians and nurses how they are doing in caring for an increased number of children with COVID-19. And their few comments to me said that they so appreciate the community that's continuing to wear their mask and to get vaccinated to protect our community as well as our kids. So it is really important to get vaccinated, especially since younger children, those under age 16, are not currently eligible to receive the vaccine. Even young, healthy people and children with no pre-existing conditions can get very, very sick with this virus. So we're asking you to take this COVID-19 seriously. Do your part to stay healthy and well by practicing prevention and getting the vaccine. As our nurses and physicians said, please wear your mask and get vaccinated. Now I'd like to turn it over to Daryl Elmucci, who can provide more information about our COVID-19 numbers at Spectrum Health. Daryl?
Thanks, Tina. Thank you all for being here. While we're all excited about the vaccine and its promise for a better future, we're definitely facing yet another surge. And quite honestly, this is one of the worst we've seen since the pandemic began. Our hospitalizations remain quite high. And as you all know, the positivity rate in our state and definitely in West Michigan is much higher than it should be. Definitely, this is the case in our Grand Rapids hospitals, but it also is occurring in all of our regional hospitals across West Michigan. In the state of Michigan, the positivity rate is around 13.7%. And here at Spectrum Health, our rolling 7-day average, and we have a very busy lab, is 16.4%. And I should note that we've increased our positivity in our lab collections since the beginning of March by almost 400%. We were at a low of just over 4% on March 1st. And so it's been a very rapid uptick, much quicker than we saw during the surge in the winter. Across our hospitals, we currently have 291 patients admitted with a diagnosis of COVID-19. This is a 20% increase over the last week and over a 35% increase over the last 2 weeks. Of the 291 inpatients we have, almost 70 are in our ICUs. So definitely a large number of people that are quite ill with this strain. Additionally, just to describe what we're seeing, the length of stay of patients in our hospitals during the surge over the winter was long. It shortened in the beginning of this pandemic because we were seeing a younger demographic that was underlying, had less comorbidities and was healthier. But over the last couple of weeks, our length of stay has increased yet again, showing that people are in fact becoming sicker and have more complicated courses. I think the theme now, and definitely when Dr. Morandi and Dr. Throop described this to you, what we're seeing during this surge is decidedly different from an age standpoint. You're all aware that during the initial part of the pandemic, and quite honestly, until we had vaccines, we saw an older demographic coming to the hospital who were acutely ill with COVID. There were always a few young people, but primarily the people that were affected the most were older. Today in our hospital, the average age of a patient with COVID-19 is 57. This is almost a decade younger than they were during the last surge. And 15% of the people hospitalized at Spectrum Health with COVID-19 are under the age of 40. And so I tell everyone, if you're 16 or over now, get vaccinated. To date, we've supplied 352,000 doses of vaccine since the vaccine was out, and we're happy to do more. We can do many thousands each day. And really the key to getting out of this surge and the key to definitely preventing another is for everyone to play their part, to do all the things that we're sick of doing, and definitely to get vaccinated. With that, I'd like to turn it over to Dr. Hossein Morandi. Dr. Morandi is the president of Helen DeVos Children's Hospital, a pediatrician himself, and he can describe what we're seeing in kids.
Sure. Thank you, Daryl. I can tell you that over the last 7 to 10 days, we definitely have seen a significant shift where we're seeing many more kids that are presenting to the emergency room here at Helen DeVos Children's Hospital with symptomatic such as respiratory difficulties and shortness of breath. And we've seen an uptick of those patients that have required admission to our floors, and even some that have required intensive care unit level of care. Definitely a change that we had seen initially throughout last year and even a few months ago. When we look at similar to adults, it's not just the ones that are underlying conditions that are coming in. We've seen many kids that have had a very healthy life and very active that are now presenting with symptoms from COVID-19. And again, as the incidence of illness is lower in children, we are seeing some kids that are having significant issues and difficulties with this virus now. I guess that from my point of view as a general pediatrician, as a father of 2 young kids, as we all know, kids cannot get vaccinated under 16. We still do not have that vaccination for them. So it really comes down to us as adults needing to do everything that we can to help them and keep them well. That means wearing our mask. That means modeling good, safe behaviors, such as getting a vaccine, wearing the masks at all times, washing hands, and really talking to kids about how do we continue to keep them safe, because as I mentioned, we have seen that increase, and we'd like to be able to address that as quickly as possible. With that, I'd love to introduce one of our emergency room physicians, Dr. Throop, who gets the chance to take care of some of these kids and to tell you a little bit more about what he's seeing in some of the adult population also.
Thanks, Dr. Morandi. Yeah, our adult ED volumes and census from all causes have returned to pre-pandemic levels after being low for some time. But there's a significant difference, as it's been alluded to. A lot of these patients are very ill, with 20 to 25% of presenters to the ED have a COVID-related concern, and a lot of these being extremely ill with shortness of breath and low oxygen levels. As both Daryl and Dr. Morandi have pointed out, this is affecting a younger demographic of patients. Our inpatient admission average age is in the 50s now. We frequently see patients in the 30s, 40s, and 50s that are very ill and that need to be admitted. And again, a lot of them do not have underlying health disease. Understandably, it's incredibly difficult for our providers and staff as their families cannot be with them when they're COVID positive. So in addition to taking care of sick patients, wearing PPE every time we enter a room, we also have to manage the communications with the families and try to be as supportive as we can for the providers and the patients that are there. So really the ED, hospital, and ICU staff and providers are doing heroes work right now, again, in this latest surge that we're seeing. As Tina mentioned, we remain very concerned with the prevalence of the B11 variant, 117 variant. We're seeing a lot of young people with high rates of infections down to the elementary school age, as Dr. Morandi pointed out. With all of that, however, I still would like to reassure people that our EDs are open and functional for every emergency health need that you need. We have full capacity staff and ability to care for you throughout the Spectrum Health region, whether it be a COVID-related concern or another emergency medicine-related concern. We're there if you need you, or if you need us. So please don't hesitate to get care when you need it in one of our emergency departments. And again, I can't stress enough what's been repeated here. The best way to fight this is to continue to mask, continue to social distance, wash your hands, and please get vaccinated if you're eligible, and encourage your friends and family who are eligible to be vaccinated as well. Thanks. Carrie, I'll turn it to you.
Thank you all. At this time, we will start taking your questions. So please put your questions in the chat. And when I call on you, please identify, you say your name and what media outlet you're with, and then go ahead and ask your question. So to get us started this afternoon, let's turn it over to Alana Holland for the first question.
Hi, thanks for taking it with WCCM. I know last time we had one of these updates mentioned that you guys hadn't treated anybody who was fully vaccinated. Has that changed over the past couple weeks? Have you been treating anybody for COVID-19 who has been fully vaccinated against the virus?
Yeah, I'll take that. Thank you. I appreciate the question. So the answer is yes. To date now, we've had 16 patients admitted to our hospitals who've been fully vaccinated, who tested positive for COVID-19. To be clear, though, of those 16, 7 had symptomatic COVID-19, meaning came in with symptoms related to COVID-19. The other 9 were incidentally discovered because we do a lot of screening testing. So these could have been patients that came in with a broken leg, with appendicitis or some other reason, and weren't actually suffering from COVID-19 symptoms. And this should tell us that these vaccines, first of all, compared to the number of patients that we've admitted overall with COVID-19, are incredibly effective. And if someone were to have COVID, the likelihood of having severe disease, as was shown in those clinical trials, remains incredibly low.
Thank you, Daryl. Let's go to our next question. And I apologize, I don't know your first name, but last name is Bouffard. I don't know.
Yes, hi. Sorry about that. Yes, it's Karen Bouffard with the Detroit News. I'm just wondering if any of your hospitals are nearing capacity or at capacity.
I will take that one too. So the answer is we're very, very busy. We're not near or at capacity, and that's the virtue of having a health system as opposed to an individual hospital. We've done a really amazing job, our teams, of helping keep care local, but we sometimes shift between hospitals when one hospital is busier than the other. Last week and over the weekend, we were busier yet, and we still remain quite busy with non-COVID related care. Right now, we're definitely very busy, but we're not at capacity or near capacity.
Thank you for that, Daryl. Let's go to Jared Letzo for your question.
Yeah, hi, Jared Letzo from the White Lake Beacon. I was just wondering, how effective is the current vaccine against this variant strain? Is it as effective or less effective or more so or whatever?
Yeah, good question. And pretty soon someone else will answer a question. These seem to be the ones that I'm probably most adept at. So the B117 strain, which is the strain that the CDC has said is now the predominant strain in the United States and definitely in the state of Michigan, is the UK variant. And all 3 of the vaccines and the 2 that we're currently giving now, which are Pfizer and Moderna, have been shown to be very effective against this particular strain. It's some of the strains coming from South Africa, Brazil, and new strains you hear about every day where there's some questionable decreased efficacy, but against the UK strain, very effective. So this should be all the more reason we all get vaccinated.
That's great to hear, Daryl. Let's go to WGVU radio for your question for Dr. Morandi.
Unmuting. All right, here we go. This question is for Dr. Morandi. First question is, how do you quantify this pediatric surge? I'm involved in kids' sports. My kids are still in school face-to-face. Compared to the spring and where we are now, how do you quantify this?
Well, I can tell you as of today, we have 10 patients who are admitted to Helen DeVos Children's Hospital with COVID symptomatology, and 5 of those are currently in our ICU setting. I can tell you in the previous surges throughout last year. I believe the most number of patients we ever had at one time was 8. So it's slightly more than what we had seen before, but nothing like the adult side.
And did you have another question?
And then secondly, if I may, the second question is a vaccine for kids. My girls are 11 and 9, and they really want to know when they also can get a vaccine like mom and dad.
Sure. The latest reports are the vaccines are being tested, and as young as 12 years of age, and they have shown significantly successful outcomes with that. So I only suspect that they will start to lower the age of the population that will be eligible for that, and will continue to do the testing in even younger ages as we move forward with this.
Thank you for that. Let's go to Dustin Dwyer for your question.
Hi, I'm with Michigan Radio. I just wanted an update on mortality during the last surge. You were able to give us a number on how many of your inpatients passed away. I think it was about 10%. What's that number? What's that number now? And can you break it down? Is it still mostly the oldest patients you're seeing that are passing away? Who's passing away this time around?
Yeah, and I can take that one as well. So you have to remember about mortality that in deaths, that it's a lagging metric, meaning first someone is positive, a week or so later they end up in the hospital, and it could be a number of weeks after that before you end up seeing mortalities. And so all these things kind of go in sequence. We're still in the midst of this surge. The good news is we are seeing less mortality than we saw during the last surge. So last time, you're very right, we were right around 10% of hospitalized patients admitted with COVID-19 who unfortunately passed away from the illness. Right now, we're about half that, so we're around 5%. But unfortunately, we anticipate that number will likely go up in the coming weeks, that percentage, as we have the delay after admission. So our hope is, because of the vaccine, because so many of the older folks that were so susceptible to dying from COVID are now protected, that we'll see less mortality. As far as the overall age of the mortality, I don't have that number handy, but I can tell you that we have absolutely seen mortality in a younger demographic than we did during the prior surge, including people that have died that were young and otherwise healthy under the age of 40.
Thank you for that. Let's go to Alana Holland. I think you've got another question.
Hi, yeah, well, I figure not enough lot of questions. Mentioned that there at the beginning of this that believe the peak might have been this past weekend. What are some of the things that you're looking at that would indicate that? Hopefully that's true, but what are some of the indications leading to that?
So when we think about the peak, we look at a number of factors such as admissions, length of stay, and the ED visits. And although emergency department visits are still high, we're not seeing the rapid increase that we saw before, and we're actually seeing length of stay be stable. And so that gives us a sense that we could be at a plateau. The thing we don't know is, because of this new strain, we just, like I said before, it is different than the last fall timeframe. And so we don't know how this is going to impact as we go forward, which is why it is critical that people continue to practice those safety prevention measures of wearing a mask and washing their hands and keeping their distance, and of course getting vaccinated. The more people that we have vaccinated in our community will really help with keeping these numbers down.
Thank you, Tina. Jared, let's go to you for your next question.
Yeah, I was just wondering, has there been any follow-up with former COVID patients from the year prior, just to kind of see what sort of symptoms they may or may not have that are, or if there are any that they might have that are lingering still, or so?
Yeah, I think, as we all know, and I think it's a very good question as a result of this, as we all know, there have been studies showing that somewhere at least 30% and possibly many more of people that have COVID develop some sort of long-term symptom complex, whether it lasts weeks, months, or potentially years and longer. We just don't know yet. We have primary care clinics, neurology clinics, PM&R clinics, which is physical medicine rehab, where we've seen all of these. We've seen many patients with lingering ill effects. We are actually now building a multidisciplinary clinic, because we think this will likely be a long-term effect even after the worst of the pandemic is gone. So I think this is going to be a public health issue, quite honestly, for the whole country, the whole world.
Thank you, Daryl. Let's go to Kristen Shamas for your question.
Thank you. It's Kristen Shamus from the Detroit Free Press. I just wondered if you could tell us a little bit about how soon you expect to see hospitalizations decline as we're also starting to see this case rate dipping. Can you talk a little bit about how we know this is also a lagging indicator along with deaths, but is it being seen now, or is it something you expect to see in the next week or two?
Yeah, if you look at the east side of the state, where they really had a bad surge again here as well, actually worse than they saw in the winter, they appear to have plateaued probably early last week. They still have incredibly high numbers that are hospitalized, but their inpatient hospitalizations seem to be at least leveling and maybe slightly going down. We participate in a regional call with health systems and hospitals all across the west side of the state. And every day over the last, quite honestly, month, it's been the same or worse each day in terms of number of admissions. Today was the first day that I can remember where finally it felt like things were maybe easing. We saw a little drop. So we think, based on what Tina described, based on the positivity rates, even though this is lagging, we think we might be headed down a bit. But I don't want anyone to be lulled into a false sense of security here, that this absolutely is both real and could easily jump back up if people let their guard down.
Thank you, Daryl. Let's go to Emily Leonard for your question.
Hi, Emily Leonard from Wood TV. Governor Whitmer requested a 2-week pause for schools and sports, and most districts did not heed that advice. With all these pediatric cases, would Spectrum leaders like to see schools move virtual right now?
I can take that question, and then I can see if Dr. Morandi would like to make any comments. I think that, I've talked to some of the school superintendents, and they have a very difficult job. Their focus is making sure that they keep their students and families healthy and safe. And everyone I've talked to has focused on masking and hand washing and making sure that the distance is separated and ensuring that the environment is safe for them. They also want to make sure that they're providing an environment so that kids can learn and can grow and can manage some of the other impacts that we've seen with this pandemic, such as mental health issues. And so it's a difficult thing. I think that each school and each school district needs to determine what is the best for them to keep their school, their students, and their families safe. Dr. Morandi, do you have anything to add?
Sure. Thank you for that answer, Tina. And I will answer this more from a pediatrician standpoint and someone that follows the American Academy of Pediatric guidelines, which have been that children as young as 2 years of age can wear cloth masks, and they're protective as long as everybody else around them follows guidelines that have been given for adults. Children as young as 2 can continue to do the everyday activities, including some of the sports events and including schooling that they have done. But it requires all of us to be very vigilant about how we approach those things and making sure that everyone around that child has the opportunity to do what is expected of them as an adult. But children have been shown to be developmentally on par to be able to wear their masks as young as 2 and continue to do their everyday activities without much hindrance to what they've done in the past.
And if I could just add 2 points, Carrie, and I appreciate Hossein and Tina's comments. Number one, I know, for instance, in Kent County, and I believe other county health commissioners have done this, they've created a framework where you look at positivity rates in the community, case rates locally, and that really helps guide their decision to make it informed for a school superintendent. And number two, and I think this is vital, whether someone is home, fully virtual, hybrid, which is, we know, partially virtual or partially at school or fully in school, the key here is to keep people separated and to keep those safety measures in place. And some of these frameworks show that as you separate kids more, when there's higher and higher positivity, you'll prevent quarantines, prevent cases. And so I definitely would ask all the superintendents to really work with their local health departments to come up with the safest thing for them.
Thank you all for those answers. Let's go back to Karen Buffard for a question. Karen, are you on the line still?
Yeah, sorry. Okay, yes, I was wondering whether or not you're able to treat many of these patients that have tested positive with monoclonal antibodies. Do you have a sufficient supply to deal with the number of positive cases that you're working with?
Yeah, and I thanks for asking, because I always love publicizing these monoclonal antibodies because they're very effective. So just to remind everyone, you use them in situations where someone is quite ill with COVID, but thankfully not ill enough to need hospitalization. And they have been shown in clinical studies to prevent progression of disease requiring hospitalization. We have a very busy monoclonal antibody clinic. We've given hundreds and hundreds of doses. Supply, thankfully, no longer is the issue. It's more a matter of getting the word out and ensuring we get the right people who get this. And in our data, we've shown that if we do get people into the clinic and get the right ones infused with the antibody, the vast, vast majority are able to avoid hospitalization and get better.
So as we're nearing time, I'm going to ask one final question. What would you say to folks who may be showing or are hesitant to get the vaccine? What would your message be? And then finally, where should folks go to get information on how to get a COVID-19 vaccine?
Actually, I think I'll start, but I'm happy to have anyone else answer. First of all, the vaccines work. They're effective. They're safe, and we've seen it in our own data from our own team members. We've seen it with our own hospitalizations. They just work. They're the best way we're going to get back to normal, number one. And number two, it's as easy as can be to get a vaccine. We know there are multiple channels to get them. We would emphasize get them wherever is easiest for you. From a Spectrum Health standpoint, we are incredibly proud of our efforts. If you go to our website, you can immediately go on and schedule a vaccine, often the same day at a location close to your home. It's free, it's easy, and please do it.
Wonderful. I'm going to turn it over to Tina for some closing remarks this afternoon.
Thank you so much for joining us today. I realize that it may seem like we're having the same conversation over and over again, but we are not out of this pandemic yet. We do know that the pandemic fatigue is playing a big role in where we are today. And as Daryl said, one of the ways to help us with this, to help our community be healthy, is to get a vaccine. It is, we've tried to make it as easy as possible to schedule to go in and get the vaccine. And from all of the research I've looked at and talked about with physicians and other clinical team members, it does work, and it is very helpful to stop this surge and keep our community healthy. So we remind you to get your vaccine, to wear your mask, to continue to wash your hands often, and then to watch your distance with others. Thank you so much for your engagement in helping us keep our community healthy, and have a wonderful day.
Thanks for everybody for attending the briefing. If you have any additional questions, please reach out to our media relations team. And thank you to our panelists this afternoon for participating in this briefing. Goodbye, everybody.
Thank you.